to ensure that there is fair and equitable distribution, that they maximize the benefit and minimize any harm to populations, and that there's a strategy. So you'll see that in phase one, there are tiers of individuals that they have recognized. The healthcare personnel and those long-term care facility residents fall within phase 1A. So that's the highest priority to be vaccinated. They are recommending that states target both hospital and outpatient healthcare providers, and that we include hospitals, outpatient clinics, long-term care facility staff, home health staff, pharmacies, emergency medical services, and public health practitioners. One of the cautions that they have noted is that we should plan for possible absenteeism, since some of the healthcare providers may have a systemic reaction, which is completely expected with vaccine, but they could have a fever in the day or two following vaccination. That's a normal reaction, but we wouldn't want them coming to work with a fever. So the next steps that we have before we receive vaccination, Pfizer has submitted their emergency use authorization to the FDA, and the FDA is scheduled to meet to determine its approval on December 10th. They're scheduled to meet to consider Moderna's EUA application on December 17th. Once they approve those EUAs, it will go back to ACIP in case the data indicated that there are any other priority populations or things that should be considered, so that ACIP can make their final recommendations. What we are understanding is that vaccine will be shipped within 24 hours after the EUA is approved and the ACIP recommendations are finalized. So we anticipate getting the first doses of vaccine in Arizona arriving around December 15th. So while we don't know exactly when enough vaccine will be available for everyone who chooses to get vaccinated, we do know that the federal government will be shipping limited doses of vaccines to states somewhere around the week of December 15th after the EUA is approved. The vaccine is going to be allocated to states based on the state's population. So Arizona accounts for approximately 2% of the United States overall population. Based on what we know right now, Arizona is expected to receive a projected total of 383,150 doses of COVID-19 in December. This is representative of only the first doses. So what the federal government is doing is they are giving us the first dose of people, holding half of the doses back. So 3 to 4 weeks later, we will get another 383,000 doses to ensure that all of those individuals get their full course of the vaccine. So specifically, we will see Pfizer starting to come the week of the 15th. Arizona will get approximately 58,500 doses, followed by increasing doses over the next 2 weeks to round out December. For Moderna, we anticipate the week of December 20th receiving our first doses, and we have been projected to receive 118,800 doses. So orders for the very first allocation of doses are due today by 5 a.m., and we're working closely with our local health partners in order to get those orders submitted to the CDC. Once ADHS and local health submit those orders to CDC, the vaccine will be shipped directly from the manufacturers to the providers who will be administering the vaccine. So they will not be coming to the state or the local health departments unless it's specifically vaccine that we are getting in order to immunize in public health clinics or in public health settings. So this allows us to work on a phased approach for getting the vaccine out. Moving on to our vaccine preparedness planning, we have been planning for a very long time with a multitude of stakeholders in anticipation of a potential COVID-19 vaccine. So we started meeting in early spring in order to make sure that we had plans in place. So our vaccine plans are based on our existing plans for pandemic influenza response, our emergency preparedness exercises, and our experience implementing the H1N1 vaccine campaign in 2010, as well as a more recent vaccine implementation response to the hepatitis A outbreak in 2019. Over the last 3 months, ADHS has coordinated and participated in multiple preparedness exercises to support a streamlined local, state, and federal vaccination effort. We have also facilitated a COVID-19 vaccine task force, which is comprised of members with a wide array of expertise, including county and tribal public health, outpatient healthcare providers and associations, inpatient healthcare providers and their associations, payers, pharmacies, and EMS stakeholders, as well as state and local emergency management agencies. So this group meets weekly to review information updates from the federal government about vaccine distribution and support statewide coordination for a vaccine program. As we've announced previously, is a working document that is continuously updated as we receive new information. It was initially submitted on October 16th and is posted on our website. So one of the most important aspects of this has been provider recruitment and onboarding, and we have been working to get providers onboarded. Starting on September 4th, ADHS rolled out the Pandemic Vaccine Provider Onboarding Tool to facilitate identification and enrollment of healthcare providers who are interested in serving as COVID-19 vaccinators. The vaccine providers are not just limited to doctors and nurses, but throughout Arizona, other healthcare professionals, including EMTs and pharmacists, will be participating to administer vaccine. As of this week, over 1,000 providers have started the onboarding process, and 359 have completed the process and are approved to receive vaccine. This week, we are conducting readiness assessment meetings with the local allocators, and I will talk about how we will allocate later on in this presentation, but to really discuss the number of initial phase 1 pod sites being set up by our local allocators. Right now, almost 50 sites for phase 1A have been approved and are eligible to receive those initial doses of vaccine. And we will continue to reassess the number of providers that are needed as the populations and the priority phases continue to expand. So providers that are interested in becoming COVID-19 vaccinators, they're encouraged to complete the ADHS onboarding tool. We are giving these reports weekly to our county health partners so that to support their local planning efforts. And this becomes very, very important because in Arizona, we are using a local allocator model. So the public health departments at the local level are working with the on-the-ground vaccinators to ensure that the priority populations and those most at risk for serious outcomes of COVID-19 are able to access the vaccine. Information on facilities participating in the CDC's Pharmacy Partnership for Long-Term Care Facilities program are also shared with the local allocators because they are going to take care of a lot of the long-term care congregate settings for our local health departments. CDC has partnered with Walgreens, CVS, and other pharmacy chains to support the vaccination of staff and residents in the long-term care facilities, including skilled nursing facilities and assisted living facilities. This partnership will serve vulnerable populations across the state, including the rural areas if it's activated immediately. So again, it's going to prioritize our skilled nursing facilities first and ensure that vaccine is delivered to all counties with eligible facilities. Those facilities that have opted to participate in this program will have their staff and residents at the facilities be able to be vaccinated within their facilities at either where they live or where they work. And so that is a really great program to make sure that we are protecting this extremely vulnerable population. The pharmacies have a contract with the federal government to provide all necessary staffing and resources, including the PPE, the vaccine that is required to vaccinate all of the staff and residents within the facility. To date, 146 skilled nursing facilities and 622 assisted living facilities have opted to participate in the program. We still have additional outreach occurring, and from what I understand, an additional 1,300 congregate care settings have signed up within the last 24 hours. We want to give a huge thank you to CVS, Walgreens, and our other pharmacy partners for providing this essential service to our population. And so vaccine prioritization, which is a very important aspect of our vaccine distribution plan, because we know at the beginning, vaccine is going to be very limited and we have to give it to the places where it will have the highest impact and prevent the most amount of cases. So as part of our plan, when we know that there are going to be limited resources, ADHS facilitates the Vaccine and Antiviral Prioritization Advisory Committee. This committee makes recommendations to the state about how to prioritize limited doses of vaccine in a fair and equitable manner. This group of experts, and you can see all of the different organizations that have representation in VAPAC, they review the federal guidance from ACIP and provide vaccine allocation recommendations based on the priority groups at highest risk for severe disease. This group considers which population should be prioritized for initial vaccine and the order in which these populations should be considered for vaccination. So VAPAC met on December 2nd and approved the following prioritization recommendations. These align with the earlier recommendations that were released this week by CDC's Advisory Committee on Immunization Practices. You'll see that we have put an Arizona estimated population into the column. The numbers in this table are an estimate of the order of magnitude of each of these populations, but are not intended to be exact figures. This provides us with estimations so we can plan vaccination efforts. So as you can see, the slide that you're looking at right now shows the phase 1A prioritization groups. And these include healthcare personnel, including frontline workers at increased risk for COVID-19, and our long-term care residents that are at highest risk for severe disease and death, and the staff that interact with these vulnerable populations. So you can see that we're estimating to have approximately 180,000 healthcare practitioners and technical occupations, along with another 70,000 healthcare support occupations, so our home health aides and those types. The 1A under the long-term care residents at highest risk, you will see that those first two groups are being serviced by the CDC Pharmacy Long-Term Care Facility Program. And so when we activate that program in Arizona, the pharmacies will start coordinating directly with those facilities to schedule the vaccine efforts. You can also see that we have included in Arizona those that are listed or living in assisted living or senior living facilities that are not enrolled in Arizona, as well as those that are in our group homes for individuals with abilities and our intermediate care facilities for those individuals with intellectual disabilities. We know that living in a congregate setting puts you at higher risk for severe outcomes, and these are some of our most medically fragile individuals. As we move on to 1B, you'll see that these are the prioritizations. There is a continuation from the previous slide. So that top category, the long-term care residents at highest risk for severe disease, while some congregate settings may not be at or house large numbers of medically fragile people, we do know that there are adults in other congregate settings that may have high-risk medical conditions. So we are including that as a 1A, 1B priority group in order to make sure that we're getting those individuals vaccinated. Essential workers are included in the 1B phase, and these are occupations and groups that keep our communities operating and ensure that we have the things we need for our lives to continue, such as power, utilities, food, transportation, and access to critical services such as electricians and plumbers. You will see, though, that there are two groups of prioritized essential workers, which include education and protective service occupations. As Governor Ducey stated during the press conference, these groups will be prioritized for vaccination prior to moving to the other essential workers. For our education and child care providers, this will include all school and child care staff. This would include bus drivers, cafeteria or food service workers, janitorial staff, front office staff, and others who work to keep school and child care facilities operating. Also of note, this table offers broad categorizations of our priority populations, but does not provide exact specificity within those categories. And not everyone who falls into these categories will be specifically called out or listed. For example, fuel transporters would fall within the transportation category, but they aren't specifically named on our table. Moving on to the next slide, this shows the final first phase, which is phase 1C. Again, please note that the numbers, they're really just approximations, but they're also not mutually exclusive. So individuals can be represented in multiple priority populations. For instance, we could have a healthcare worker who is 65 years old with diabetes. Individuals should get vaccinated with the highest priority group that they fall into. In this example, while they may be represented in each of those three priority populations, we would recommend that individual get vaccinated during phase 1A with the healthcare workers. Another example is our prison and jail population. This will be done in multiple phases throughout phase 1. So healthcare workers in our jails and correctional facilities will fall into 1A with the rest of the healthcare population. Our correctional and detention officers will be vaccinated during phase priority 1B with the protective services occupations. Inmates or detainees with medical conditions that puts them at high risks for serious outcomes will be vaccinated during 1B as adults that have high-risk medical conditions living in congregate settings. Finally, the general population inmates or detainees who do not have medical conditions will be vaccinated during 1C as adults in congregate settings. Moving on to the next slide, you'll see that we've included table 1S. This is in our prioritization document. But these are subpopulations that we want our local allocators to consider and potentially sub-prioritize based on vaccine within their jurisdiction. And we want them to consider this as a sub-prioritization for all phases, especially when there are limited amounts of vaccine available. So to give an example of how this table would be used, we may have a healthcare worker that has a disability and needs to be vaccinated prior to other healthcare workers. If there's limited vaccine, those are the types of things that they would take into consideration as they are moving on. You will see that we've included pregnant women and children age 17 and under. However, that they are not included in these initial vaccine prioritization because they have not completed the clinical trials. So they are not being recommended as vaccine priorities at this time. So to give a general overview of Arizona's vaccine distribution system, Arizona is what's considered a home rule state. So each county and tribal health department reports to its own local governing authority. They do not report up to the state health department. So in Arizona, they will serve as the local allocators. They will be making the decisions on where the vaccine goes in their respective jurisdictions. Currently, there are 15 counties and 3 tribes that have opted to be local allocators for a total of 18 allocators. So as we use the local allocator model for vaccine distribution, our local partners are the backbone of vaccine program implementation on the ground. Based on the CDC guidance, initial vaccine doses available under the emergency use authorization are expected to be updated weekly. So I'll walk you through this flow chart on the right. So every week, the CDC will get a certain number of doses that they will release to the states. Based on the allocation that the states get, the CDC will notify ADHS of the number of doses that we will receive. We then will break that up based on the priority population pro rata per county. So we will be telling the counties how many vaccines they will receive that week based on the priority populations. They then will notify us to let us know how many vaccines should go to each individual vaccinator. ADHS then places that order with the CDC, and then the CDC distributor will ship vaccine directly to the providers that are approved to receive an allocation. So the state and local health departments will not receive that vaccine or serve as a middleman in the distribution chain. Once they get that vaccine, then it will go to the clinic in order to be used as vaccination efforts. One thing to note, and I will get into this a little bit later, but you will see that there is a side arrow outside of the red box. That is where the CDC will directly allocate vaccine to federal partners for certain federal groups. And I will go through which groups those are in a little bit. So the vaccine distribution system is just expanding on an already existing system. So every year, over 80 million vaccines are distributed through the federal system throughout the United States. They are allocated by the states and shipped directly to providers. We are growing this system in order to accommodate the vaccination needs for COVID-19. So again, the federal partners will announce the number of doses available for the state to order in a given week. The state then divides this allocation up among the various local health partners based on the priority population within that jurisdiction. The local allocator then will use an ADHS developed allocation tool to place vaccine orders. They use that tool to specify the number of doses that they would like sent to each pre-designated vaccine provider. So the providers have to be onboarded and enrolled in the program in order to receive that. So ADHS is going to collect all of the local orders and place the overall state order for vaccine with the federal government, letting them know how many doses should be shipped to each location based on the local allocator orders. Finally, the federal vaccine partners directly ship the vaccine to the providers who will be administering the vaccine at their sites. Vaccine shipments will be accompanied by all of the necessary supplies, including needles, syringes, the personal protective equipment, patient reminder cards, and vaccine information sheets for the patients. And as vaccine becomes more widely available, the local allocators will no longer need to place jurisdiction-wide orders, and the vaccine providers will be able to directly order through ADHS's ordering system the way they do for their routine vaccine. Here's a list of the federal entities that will receive the direct allocation. So the federal government is going to be working directly with federal partners to provide vaccination to their populations. So these include the Department of Defense, Department of State, the VA, and the Federal Bureau of Prisons. Our tribal partners were actually provided a choice of either being identified as local allocators through their tribally operated health clinics and working with their states to be a local allocator and be included in the state's allocation, or they could receive doses directly from our federal partners through Indian Health Services. 3 of our tribal partners system, and the remaining tribes are going to work through Indian Health Services. So public access to COVID-19 vaccine. So each local jurisdiction is responsible for establishing their initial vaccine sites in partnership with local providers. So in most cases among the counties, a small number of regional sites will be operational to provide the vaccination for healthcare workers in the phase 1A priority groups. These will likely be operated by major healthcare systems or health partners, and will involve appointments and drive-throughs in order to be the most efficient with getting that group vaccinated quickly. ADHS has developed a priority populations dashboard so that as additional vaccine becomes available and the state opens up vaccine eligibility to those phase 1B populations, the strategies may differ between local jurisdiction. So many of them may maintain some large regional vaccination sites, and others will implement additional strategies, including employer-based vaccine clinics for essential worker populations, or coordinate with local clinics that are serving high-risk groups. So counties will have access to the priority populations dashboard, which provides the information about each of the population that needs to be considered as we plan for the phased rollout of vaccine. This database breaks the information into census tract level populations, and GIS maps the vaccinators so that counties can ensure a fair and equitable distribution to our high priority groups. When vaccine is more widely available to the general population, more healthcare providers within the community will be allocated doses of vaccine. So that will further expand accessibility of vaccination. Local jurisdictions will use a variety of mechanisms to communicate with community members about eligibility for vaccine locations, and how to acquire that. So ADHS is committed to making as much information about vaccine sites as possible available on our website, similar to information about COVID-19 testing sites. And we will clearly communicate the vaccination phase that the state as a whole is in. We get a lot of questions about the vaccine costs. So we want to ensure the availability of COVID-19 vaccine without financial barriers. We want everyone who wants to get a COVID-19 vaccine to have access and be able to get that. So the Federal Centers for Medicare and Medicaid Services has released a plan to support provider billing for vaccine administration at no cost to the patient. So the vaccine is going to be provided at no cost to the providers as a federally supplied vaccine. With some vaccines, there can be an administration fee. This is a fee that a provider would charge either insurance or the patients in order to actually prepare and give them the vaccine. As part of Executive Order 2020-57, Governor Ducey required all insurers regulated by the state to cover COVID-19 vaccine and administration fees without regard to whether the provider is in network. So every vaccine provider you go to get a COVID-19 vaccine will be considered in network for your insurance company. Governor Ducey worked to further remove barriers to vaccination by signing Executive Order 2020-58 to make COVID-19 vaccine available at no cost to all Arizonans. So as I mentioned previously, this vaccine has a challenge because there is a second dose. And so how are we going to remind individuals about getting that dose at the appropriate time and what dose to get? So the vaccine kits that are shipped from the manufacturer will come with second dose reminder cards that will be handed to the individuals at the time of the vaccination. Local jurisdictions and vaccine sites will have different processes for conducting reminders for patients to return to that second dose. Some sites will be scheduling second appointments when the patients arrive for their first appointment so that it's already set and they know when to go. And then some will be utilizing electronic reminder recall capabilities that are already existing within vaccine management systems, including ACES. And then the CDC is looking at solutions for ensuring access to the correct presentation. In case we have winter visitors that go back or come here to Arizona, we'll be able to see what types of doses they've gotten in other states to ensure that we get them the appropriate second dose. And in order to make sure that people are getting the appropriate second dose and that we are ensuring that our high priority vaccine populations are being vaccinated, we do have a element of vaccine reporting. And my slide is not going forward. Sorry. There we go. Thank you. So providers in Arizona are required under Executive Order 2020-57, which was an enhanced surveillance advisory, to report information about COVID-19 doses administered. They need to report that to ADHS to allow us to monitor the rollout of the vaccination program and determine vaccine coverage among our population. ADHS has also signed a data use agreement that is in place with the Centers for Disease Control and Prevention to report back limited data about vaccine program implementation. This information will allow us to ensure we are reaching the underserved and high-risk populations and provide accurate information for individuals so that they can get the appropriate second dose at the right time. And many of these you'll see from the examples on the slide are electronic reporting, so it will happen almost simultaneously depending on the route, but we can receive EMRs through the Health Information Exchange and through ACES. So we are hoping that we will get the information in order to be able to prioritize those populations. We will continue to as we do all the time, but vaccine safety monitoring. The CDC has a robust vaccine safety monitoring system called VAERS that has been in place for years that allows healthcare providers to report any clinically important events reported by a vaccinated person. So this system includes a call center that will conduct follow-up as appropriate. In addition, the Centers for Disease Control and Prevention have established the vSafe system, which will provide a safety assessment for essential workers and healthcare providers. Participants will receive a text message check-in or email from CDC daily for 1 week post-vaccination and weekly afterwards for 6 weeks to monitor for any adverse reactions. And ADHS partners very closely with Arizona's Poison and Drug Information Systems to share information, and will engage this partnership to conduct additional monitoring of vaccine safety. And finally, vaccine communication. ADHS has engaged with a partner organization to conduct surveys of healthcare workers and the general public to better understand their perceptions of vaccine, their intentions to be vaccinated, and their trusted sources of health information. It will be critical to develop messaging on vaccine safety, efficacy, and importance. The surveys target both healthcare practitioners and the general population, and will include a lot of different questions about vaccine confidence, what the hesitancy is, and this will help us target how we develop our campaigns moving forward. One of our key priorities is reaching underserved populations as well as vulnerable individuals. Based on recent surveys, the data regarding vaccine hesitancy seems to be improving. Back in September, an Axios Ipsos poll showed that 6 of 10 Americans do not want to receive the vaccine when it comes out, with significant differences observed by racial and ethnic groups. However, a CDC survey recently shared at the public meeting of its Vaccine Advisory Committee on November 23rd found that 63% of healthcare workers polled in recent months said they would get a COVID-19 vaccine. So this is very promising, and the information gathered through all of this work will allow ADHS to develop targeted communication strategies in partnership with local jurisdiction to communicate with Arizonans and address questions and specific community concerns about the vaccine. The ADHS vaccine webpage is now live in English and Spanish and will continue to be updated as we get more information. It currently includes background information and frequently asked questions. So vaccination is the key to protecting everyone and getting our families, communities, and economy back to normal. The more people who become vaccinated, the stronger the protection for those around them, especially vulnerable individuals who can't be vaccinated. So to get as many possible to roll up their sleeve requires getting the word out that the vaccine is safe, effective, and for everyone's benefit in our communities. So thank you, and I will turn it over to Steve. I am happy to take any questions.
Okay. Can we bring up the video of Cara? Can we bring up the shot of Cara?
Yeah, they did.
All right. Our first question is for Juan at Telemundo.
Hi, Juan.
Hi there. Good morning, Dr. Cara Christ. So my first question is, you mentioned that on the 15th of December is when you guys expect to have the first shipment come through Arizona. Can you just elaborate? Would the first group of people be eligible, like, I don't know, the next day right away to get the vaccine? Or is that going to take some time still, even after getting the shipment sent to Arizona? And my second question, if you can also talk about it, I was working on a story yesterday regarding the school staff and teachers. A lot of people were asking us about that. How soon do you think that group would essentially be given the vaccine as well?
Sure, those are great questions, Juan. So first, with the first doses expected to arrive around December 15th, those will be shipped directly to the vaccinators. We are currently doing readiness assessments with all of our local jurisdictions and looking to see, our expectation is that vaccine be provided within 48 hours of it being received. We do know that some of these sites are going to be very large and need to be stood up, but it should just be within the couple of days following them receiving the vaccine. So we expect that the week of December 15th. For the question about the schools, when we look at the populations or the estimated numbers of the populations in the priority 1A groups, we anticipate that we will probably be getting to some of those highly prioritized, our teachers, our childcare workers, our education occupations, as well as our protective services, probably around the beginning of January.
Great. Our next question is from Ina at News 4 in Tucson.
Hi, Ina.
Hey, it's actually Eric at KVOA. Ina, or rather Ina, RSVP, but it's Eric. So hey, Dr. Christ, how are you?
I'm good.
Wanted to if you can kind of elaborate a little bit on the community health departments or the county health departments rather, and their role as these local administrators.
Yeah, so the county health departments are actually the backbone of this vaccine plan. So they are working with providers to identify where they are in the community to make sure that their vulnerable populations are going to be able to get served, and they're identifying where those vaccinators are going to be. So when we get these first doses of the vaccine, they will be working with those large healthcare systems in order to stand up through the healthcare systems, the vaccine sites, so that the healthcare employees can get vaccinated rapidly. As we start to expand the groups, they're going to be using those priority populations as they determine who gets what number of doses. So if there is once we get into the essential workers, they're going to start working with like employee vaccinators, like health waves that can go into large essential employers and vaccinate their employees. But they're also going to be making sure that other areas for groups that may not have a centralized workplace, to make sure that they can go get that within their community. So they're really going to be the intelligence and the boots on the ground for determining where that vaccine goes in their local communities.
Next up is Peter at KTAR.
Hello, Dr.
Hi,
Chris.
Peter.
Thank you for being available today. How are you? Good to see you. I wanted to ask also, can you provide a little more clarification on public and private providers? If I understood this correctly, they'll be making orders through the state, and then the feds ship the vaccines directly to the providers. Did I hear that correctly?
Yes, yeah, you absolutely heard that correctly. So we have both public and private providers that are registered and have been onboarded as vaccinators. So when the local health departments or the local tribal jurisdictions tell us which provider should get that, we're going to place that order on their behalf to CDC, and CDC is going to directly ship the vaccine to that provider. So for example, if Dignity Health is one of our massive immunizers for our healthcare providers in phase 1A, they'll work with Maricopa County. Maricopa County will let us know they need this many doses. We will place that order, and then CDC will ship directly to Dignity at the address that they've provided.
Got you. Okay, I think that takes care of it. Thank you.
Perfect, thank you.
The next question is from Howard Fisher.
Hi, Howie.
Hi, doctor. How are you?
I'm good, how are you?
Good. So I was concerned about something you said about the follow-up on the survey that says 63% of healthcare providers would get the vaccine, which suggests that 1 out of 3 won't get it, which raises the question of, if they're providing healthcare, if they're in congregate care settings, can you force them to get the vaccine? I mean, if 1/3 of healthcare providers are unwilling to do it, then these are the medical professionals. How does that affect the people they're caring for? And B, what does that say for public confidence in the vaccine?
Well, actually, that's just based on survey results, which when we know that when more data comes out, that number will continue to increase. Healthcare providers usually are a very well vaccinated population. What I will say is that this is the same type of dilemma that we face with flu. Employers can mandate that their employees get that. There are some employers that do mandate that, but it won't be mandated at the state level.
Fair enough. Thank you.
Our next question is from Stephanie Ennis at the Republic.
Hi, Stephanie.
Hi, Dr. Christ. I wanted to ask, do you think you can get through all of 1A, vaccinating that whole group with their initial doses by the end of December?
So that's a great question. So we are hoping to be able to do that. We're working with the large health systems to set up mass vaccination sites, or I should say the local county health departments are. And so they will be large drive-in sites that are very similar to the testing sites that they are operating, where they can do high volume quickly. They will also be doing a pre-registration and appointment base. So our goal is to get through as many of those healthcare providers as we can by the end of December.
And health providers, they're done before long-term care residents, or are they all done at the same time?
So what we believe is it'll be a staggered approach. We will likely start with the initial vaccines going to the healthcare providers, because we have to activate that CDC long-term program, the partnership program. Once we activate that, they will take a certain percentage off of the top of the state's allocation and divert it to the CDC partnership so that they can go out and do that. It takes about 2 weeks for them to be able to, once we activate it, for that to start up. So it will be a staggered approach. But once we activate it, they will be going on at the same time.
Thank you.
Welcome.
Next up is Mike Kelton, ABC 15.
Hey, Dr. Christ, appreciate you taking the time. Two quick questions. One is similar to what was just asked, and I understand the logistics you just talked to, but my math, 383,000 doses by the end of the year, very rough math, 375,000 people, I think I added up in 1A. I understand the logistical challenges, but from a dosing perspective, if you're in group 1A, can the expectation be that by or around the new year, you will have an opportunity if you want it to go and get that? My second question is, as the head of our health department, what is your biggest concern, or what are you most focused on in making sure this giant operation runs as efficiently as possible?
Those are great questions. So for number one, our anticipation is that by the beginning of the year, that everyone in phase 1A, it may be a little bit different based on the CDC pharmacy contract, just like how quickly they can get through that. But we should have those groups have an opportunity to get vaccinated. And one of the things that we want to make sure, the CDC, once we activate that, that will spread out into the rural areas as well. So we are anticipating that those populations should have an opportunity to receive vaccine. That's, depending on that, if the projected dose amount is what it is and that it comes in when we're expecting. On your other question, there's a lot throughout this whole pandemic that keeps us up at night. I would say, making sure that we have the providers in the areas to, once we reach into that 1B and into the general population, that we are getting those that are most at high risk. Some of those in areas with a high social vulnerability index, those that may be harder to access because they're living at home or alone, but really trying to get out to those populations who desperately need the vaccine.
Our next question is from Katie Davis-Young at KJAS.
Good morning.
Hi there. I'm just wondering if you could clarify that 383,000 estimate. Is that just what you're estimating based on the doses that are reported to be available soon, or is that the number you plan on requesting?
So that is a really great question. So what the CDC has done is they have put those projected doses actually into our systems for ordering. So it's called Tiberius, the other one's called VTrax. So they have uploaded those doses in order for us to begin getting ready for ordering. So our first order for that 58,000 doses is actually due today at 5 p.m. So those are pretty good projections for us to base planning efforts on. They could change a little bit depending on if something happens with the production, but from what I understand, these doses have already been produced and they're getting ready to be distributed. So
and then the list you showed today of the priority groups looks like that's been updated from the original draft plan from October. Is that going to be posted on your website anywhere, or is that available to the media?
Yes, so that will be posted on our website, likely at I believe it's azdhs.gov/COVID-19 vaccine. We'll get you that website, but it will be posted there. It will have those priorities. Keep in mind that while ACIP did provide the draft recommendations, the final recommendations will come after the emergency authorization is approved. So there could still be some final tweaks on that, but we'll keep that updated as we move forward.
Next up is Bob Christie, AP.
Hi, Bob.
Hi, Dr. Christ. Hey, I was also looking at the previous, the draft vaccine plan. And by my math, if you add the long-term care with the 1A group, we've got 470,000 folks, not 383. So we won't get through that whole section in this first month or so. Still, that's only, that's a small percentage of the population. Can you address that? Can you talk a little bit about what 3 tribes did sign on to this state so that I have that number? And then I'm more concerned with when do you think we will get, this is the first dose. So a month after that, the second dose will come. Then we'll have 10% of the population protected. When do you expect you'll get to 70%, which is the gold standard for some type of effect in the community, stopping community spread?
So that's a lot.
Right.
Keep me on track to make sure that I answer.
The initial number was that I have is about 470 folks in the 1B. If you add long-term care, or in 1A, if you add the current 1A from the draft plan and long-term care, it's about 470,000 people. So you won't get, in this first tranche in December, you won't get all of those folks vaccinated.
So in the first tranche, what we will be doing is we will be doing the healthcare providers. We did not select out the healthcare providers. So we know that there's some doubling in that, and not everybody is going to want to get vaccinated. We will be prioritizing out of that 1A, those high risk skilled nursing facilities. So all those 146 should be done, or at least provided the opportunity by the beginning of the new year. As we move into some of those other groups, we are trying to bring them into that CDC pharmacy program so that we can have them go directly to those sites so that those medically fragile people don't need to come. But we are anticipating that they will at least have the opportunity. But you're right, it's a lot of people with limited vaccine coming in. So as we get that limited vaccine, these are the first doses. We will then, as the second doses come in, they've already been produced and they're just holding them for 3 to 4 weeks. So the new vaccine will continue to come in. So the numbers will continue to get bigger and bigger for the allocations. They will also be adding in that Moderna, the Moderna doses as well. We anticipate hundreds of millions of doses by like March or April, and that's when we feel that it will finally be open to where we'd be able to get to the general population. And you had a third question, and I'm blanking on it. Oh, the 3 tribes. I will have to get those. I don't know them off the top of my head, but we'll get you that, Bob.
The next question is from Brian Webb at Fox 10.
Hi, Brian.
Hi, doctor. How are you?
I'm good. How are you?
Hey, good. Thanks. Piggybacking off that, do you anticipate once we're ramped up to get to the general public, how many doses per day we'll be able to give out, and how long it will take to get through the basic general population? And then lastly, is this the kind of vaccination that will continue for months and years beyond this current period? Thank you.
Those are all really great questions. And I didn't check. So the team actually in that provider dashboard, there is data, and I'll have Steve follow up with you on that, about how many vaccines can be performed and we can break it down by county based on the current approved vaccine allocators. So we can get you that information. I apologize that I don't know it just off the top of my head.
Sure.
What was the second question, Steve? Why did I forget that?
To get through the basic general population, and then we'll have to continue giving out vaccines till I'm an old man.
So this will likely become potentially one of those vaccines that becomes like part of the recommended vaccine schedule. Right now, it is not approved in children or pregnant women. We anticipate that will be showing up in the next several months. But it's probably going to be like the summer, early fall, before everybody who wants it has had an opportunity to go get it and go get both doses. What we don't know is how long that immunity lasts. And if it's going to be something like a flu shot where you have to go get it every so often, or if it needs a booster, like we need to get, our measles boosters, like when we're 18, those kind of studies will still be ongoing.
Thank you.
Welcome.
Next up is Wendy Redmond at KOLD in Tucson.
Hello. So I guess this kind of goes off of a little bit of what we were just talking about, but I was wondering, will the vaccine be required for students to attend school? Obviously not the school-age children, as we were just discussing, or could it fall under some kind of exemption guideline, or would this just be something for the future we look at? And then also, if people at home feel like they're really far down the list and think that they should be up higher in a higher priority group, is there a way for them to petition to get the vaccine sooner, or what do they do?
So with the vaccine requirements, that probably is looking down the road quite a ways. We had talked about potentially employers, like healthcare employers, requiring healthcare employees to get the vaccine in order to be able to work. And that's not going to be a state requirement. When we talk about school childhood doses, Normally what happens is that ACIP makes a recommendation that a vaccine become, a part of the recommended childhood vaccination schedule. When they update that schedule, every so often, ADHS will take a look and see what vaccines that Arizona should consider as required for entry to school. However, even if we do add a vaccine that's a requirement for school or childcare, parents in Arizona have the opportunity, especially to either exempt out on philosophical reasons or to, if they've got a medically fragile child that cannot get vaccines, they are obviously a medical exemption. We encourage that children be fully vaccinated with all of their vaccines, though, because we've seen what a communicable disease can do to the community. And then the other was if somebody feels that they should be bumped up, what we would recommend, there's not a petition process right now. We would recommend that they work either with their healthcare provider or their employer, because those are going to be the two sources of who will decide. If the employer knows that they're part of an essential occupation, we'll be able to work with them to get them either vaccinated on site or to identify where they can go get vaccinated within their local communities. If they're medically fragile or if they're over 65, that is one of those things that your either healthcare provider or your public health department will be able to direct you once that group opens up. Does that help?
Next up is Joe Dana, 12 News.
Hi.
Good morning, Dr. Christ. Yes, two questions. First, so the subpopulations mentioned that are an increased risk for acquiring or transmitting, it includes 3.2 million adults from racial and ethnic minority groups. So can you clarify what does the jurisdiction or a provider do with that information?
Right. So what we would want to do is to consider those types of populations as they're the local health departments, as they are making their allocation decisions on what providers go, we would want them to consider those priority populations. So if we're opening it up to the general population, this would just be an example. But what we would want to do is make sure that we had vaccine providers in some of those areas that have been really hard hit, such as the South Phoenix area, the Maryvale area. And you would prioritize potentially those areas within the population over other areas that may not have a population that has had such significant outcomes. You could consider the same thing as you were looking at essential workers. You may look at some of those fields where you're going to hit more of those impacted populations, whether it's college students, whether it's people from with high social vulnerability indexes, or ethnic or racial populations that have been significantly impacted by COVID. So those are all things that we want everyone to take account as they're making those plans.
Okay. And second question, do you know the dollar amount that will be paid to providers to administer the vaccine?
I believe it's in like the $20 range, but we do have that. I'll get Steve to get that to you.
Great, thank you.
You're welcome.
And the last question of round one is from Cronkite News. Is it Joycelyn or Jocelyn? I apologize.
It's Joycelyn.
Good.
Hello.
Hi. I was wondering if you guys had any list of you mentioned over 1,000 providers that have started the planning process, and there's currently 359 that are approved. Is there a list of those approved providers that exists anywhere?
I will have Steve look into that and see what we can release. Absolutely.
Okay, thank you.
You're welcome.
And we have a bonus question from Stephanie Ennis of the Arizona Republic.
Okay. Is it like Jeopardy?
Yeah, I'll try to make this quick. Just two parts. One is, does Arizona have the necessary short-term and long-term funding, including staff, to distribute the vaccine? And then the other question is just, what are the major hurdles you've encountered so far in this process?
Those are great questions. So we are working with our local healthcare providers in order to be able to provide the vaccine. So the federal government, while we're making it as free as possible to our citizens to get the vaccine, they are also ensuring that there are adequate reimbursement on the other side for providers that are offering the vaccine. So making sure that there is a pathway that they can bill for uninsured or underinsured patients, and that there aren't really any barriers for getting reimbursed through insurance for providing that vaccine. And the vaccine is being provided with all of the supplies directly to. So we are working with our county health departments to identify. Currently, for all of the things that we have initiated, the vaccine management system, all of that, we do have the funding. We did get a couple $1 million in order to do planning efforts. So we are constantly evaluating. Public health can always use more funding to do the projects that we want, but right now we do have the funding that we need in order to be able to do that. But we continue to work with our public health departments to identify what any barriers or any funding needs are. Some of the barriers, I think, have been working around the second dose notification and ensuring that we have the mechanisms in place to be recalling people, and the data sharing agreement. So the executive order was really great because it does allow for us to do that data sharing, because we did not want to put Arizonans at a disadvantage for not being able to receive vaccine because they're in a different location when they need to get their second dose, or to prohibit people from, like our traveling nurses, from traveling here because they may not be able to get the second dose if they received the first dose in their home state. So those were some of the technical challenges that have been barriers, but we've been able to work through.
Thank you.
We'll head back to Tucson again and to get a question from Eric at KVOA.
Okay.
Hey, Dr. Christ, thank you. First, two-part question. First, how is the 383,000 plus doses, how was that number determined? And then secondly, on those 500 traveling nurses from out of state, will some of them be on the ground to help give the vaccine as hospitals across our state are still stretched thin with the influx of the COVID-19 surge?
So for the 383,000 doses, the federal government, from what I understand, is just taking the pro rata allocation off of the state's population. So they're giving us, they'll have 40 million total doses by the end of December. We're getting that 2% of that. Keep in mind that this 383 is only the half of that total allocation. For the traveling nurses, those really are meant to be providing inpatient services at the patient's bedside to help increase the number of available beds for Arizonans. So we are requesting med-surg nurses, ICU nurses, and emergency department nurses to bring them in. So what we would do is we would work with, if we needed, and we've put this notice out to our health systems partners, if they need additional staff because they have reduced staff either to COVID-19 or because they're all working in the hospital, to let us know so that we can bring in contact track staff. We're also working with some of the local universities. They are providing nursing and medical students to administer vaccines at some of these major sites so that they don't have staffing challenges. But we are working with those providers to see what resources they think they will need coming up.
Thank you.
Welcome.
Okay, we have run out of questions, Dr. Christ.
Oh, well, wonderful. Well, thank you everybody for joining us. We're always here. So if you have additional questions or things come up, you can always reach out to Steve to get more questions answered. We will be posting our prioritization and all of that on the website, as well as we are planning on posting like the number of doses and what phase we are in on our website moving forward as that starts coming through. So we're happy. I hope all of you have a fantastic weekend and a great Friday night. And I look forward to talking to you guys next week. Thank you.